So colleagues, good afternoon or good morning or wherever you are in the world, and welcome to the Usher COVID-19 webinar series. My name is Linda Ball, Professor of Public Health in the Usher Institute at the University of Edinburgh. And I'm going to be co-chairing this webinar with Professor Igor Rudan, who will join the panel at the end and will certainly share part of the discussion and thank the speakers at the end. So just to acknowledge Igor and thank you very much for his involvement in identifying the speakers for this webinar and also co-chairing. So many of you will have attended before, you know the process. If you have a question, please do add questions to the Q&A box at the bottom of the screen, and then at the end during the discussion, Igor and I will pick out those questions and ask them to the speakers. So please do be thinking actively about your questions, because those of you who've registered on Zoom, we're dependent on you for those questions to be added. We've got other people watching live on YouTube who haven't had to register. And please remember that the live stream will be on YouTube, and if you'd like to watch it later, please do pass that link on to your colleagues. So I'm really delighted to introduce you to our two speakers. And also just to mention at the end, Igor is going to flag the last webinar of this year, which will be in the middle of December. So we're really pleased that two colleagues who submitted an excellent article to the Journal of Global Health, which of course is edited by Igor and colleagues here at the University of Edinburgh. They had their paper accepted and they're going to present results from that, but more broadly as well. So we're going to have our first speaker is Dr. Sheng-Fang Su, who's an assistant professor in the Graduate Institute of Oncology in the College of Medicine at the National University of Taiwan. She traditionally has worked in cancer epigenomics, but of course she's expanded her work to look at the current crisis and issues around that as well. So very grateful to Dr. Su. And then our second speaker will be Dr. Yueh-Ying, who's a research associate and professor of pediatrics at the University of Pittsburgh at the moment, originally from Taiwan. And you can read her biography on the site, but she's served as an epidemiologist to several NIHR funded grants and has training in epidemiology, in particular interest in asthma and respiratory health. So really delighted to hand over that to them. So I will ask Dr. Su to speak first, and she can share her slides. And also just to emphasize again, do be thinking of your questions. So Dr. Su, feel free to turn your video on and I'll hand over to you with the slides.
Okay.
Wonderful, thank you.
Thank you for the introduction. Firstly, I would like to thank Dr. Bolt for the invitation to the webinar series. I and Dr. Han are thankful for having this opportunity to share Taiwan's model in the response to COVID-19 here with you. We truly hope through today's presentation and communication, we all could learn lessons from this pandemic and are able to effectively prevent or better response to the next public health crisis. So 2020 has been a tough year for everyone around the world. While the world continues to experience many adverse impacts from the COVID-19 pandemic, Taiwan has been recognized as a success story for pandemic management, as you can see across the news and multiple media channels. This is a figure from my article showing the timeline of the confirmed cases of COVID-19 outbreak as of the end of April. I will update you the current number later, but this is to show you the early phase of the curve occurred in Taiwan. As of April 28th, Taiwan had 429 total confirmed cases and 6 deaths. Early in January, people in Taiwan already understood the importance of wearing face masks and washing hands regularly, and actively cooperated with government policies and measures, which significantly improved the effectiveness of the policies. Taiwan CDC taught people how to wear masks correctly. So as early as January, Taiwan community, from the government to the public, had been already aware of the epidemic seriously, while others, as you know, had sharply increased confirmed cases. And this is what happened. You can see the spread of the virus. NextGen built tools to visualize the spread of the virus. it is the time to rethink how the world is tightly connected. Taiwan, located 130 kilometers from China, has about 24 million people and has strong trade and transport links with China. Last year, Taiwan has almost 3 million Chinese visitors, so it was predicted to be one of the most at-risk countries affected by the virus in January. However, Taiwan has defined expectation to have only 607 total confirmed cases and 7 days as of November 19th. How Taiwan learned experience from the 2003 SARS has become a successful example during the COVID-19 pandemic. So it's science, in my opinion. That's why I wrote this article from the scientific perspective. On December 31st last year, epidemic prevention physicians of Taiwan CDC were alerted by 7 cases with suspecting atypical pneumonia from Wuhan, China, and immediately took actions on that day. We know the possible route of transmission of pneumonia, SARS, and the coronavirus. This figure illustrates different transmission routes that can be transmitted via person to person to cause an infection, such as airborne route, direct spray route, and indirect contact route. And the Chinese black light experiments show how quickly a virus like COVID-19 can spread at a restaurant. So Taiwan CDC immediately took actions from day one. Here is the key factors of Taiwanese first phase of defense. Taiwan has imposed timely border restrictions, activating the CECC to work on preventative measures, community transmission prevention measures, resource allocation, and provide transparent information. Taiwan applied technology to strengthen isolation and quarantine measures, employ national health insurance big data to help frontline workers detect cases. And also the coordination of whole Taiwanese society made Taiwan's success in fighting COVID-19. Taiwan government immediately called a press conference on the COVID-19 outbreak and immediately conducting on-board quarantine starting from December 31st last year. To enhance border control and quarantine measures, on February 11th, an electronic health declaration system was established for returning travelers, allowing updating healthcare service. Starting from March 19th, home quarantine measures have been expanded to include arriving passengers from all countries. And Taiwan initially adjusted the level of travel notice for individual countries and issued a level 3 travel notice for all countries on March 21st. On January 20th, even before the first importing case identified, Taiwan CDC activated the Central Epidemic Command Center, CECC, to work on disease prevention measures. Since then, the CECC hosts a daily press conference live stream to establish a transparent, immediate, and professional platform for communication with the media and the public. Data on the outbreak situation and then disease survey results are provided on the official sites. And any policies or clarifications of false information are immediately announced through these channels. The timeline lists the actions taken by Taiwan government during this pandemic. As you can see, as of April 5th, Taiwan rapidly implemented over hundreds of actions to prevent the spread of the disease. The CECC providing promotional materials and videos in different languages to timely announce information. And early quarantine procedures were also established for people entering Taiwan, from arrival to the transportation and the quarantine hotels. All are ready for the international and overseas students. For the charter plan operation, CECC deployed a thorough onboard quarantine procedure, including fever screening and health assessment conducting. Individuals with symptoms were sent to negative pressure isolation wards directly upon arrival. All others with negative testing results were sent to central quarantine sites by designated transport vehicles and placed under 14-day period of quarantine. Their luggage were disinfected, and all related healthcare workers were personal protective equipment. And the CDC picture card is provided every day to report any new confirmed cases with the latest situation and the number of contacts to undergo quarantine. People in Taiwan get information about COVID prevention, number of total confirmed cases, total deaths, and the number of individuals removed from isolation up to date. The government continues to raise awareness of epidemic prevention. The CECC decide health education materials and provide material through various media channels to promote self-protection measures and to keep the public informed. In addition to wear masks, the CECC also calls on all citizens to regularly wash hands, clean their homes, and keep social distance to protect their health. The 1922 Communicable Disease Reporting and Consultation Hotline has been provided for people to consult and report cases. And transportation arrangements and quarantine hotels were designated for home quarantine and isolated individuals. From March 4th, people subject to home quarantine regulations required to use epidemic prevention transport service instead of public transportation. Taiwan central and local governments providing consultation and support service for the assistance of transport arrangements and participating quarantine hotels. By coordinating closely between hospitals and central government, Taiwan CDC designating isolation hospitals and responding hospital and provide guidelines for clinical management of COVID-19 infection. Taiwan's major medical facilities work to limit the size of work units. Steps were also taken to control the flow of patients and visitors into hospitals. Hospitals establish separate entrance and exit for in and out patients to help prevent the spread of infection. In addition, integration of health and immigration database help doctors check patients with travel history if symptoms were shown. Taiwan government requisitioned all production of medical masks from domestic manufacturers from January 31st to ensure the local supply. A name-based rationing system for mask purchase was launched on February 6th for the public with their national health insurance cards. Starting March 10th, people in Taiwan have the option of pre-ordering their weekly ration of masks online and pick up them at the convenience stores. 9 masks per NHI card every 14 days, starting from April 9th. Since the release of open data by the government's open data platform, mobile service providers such as LifeSpot can search the nearest health insurance pharmacies or health center that can buy masks sorting by distance. It also displays the remaining number of adult or child masks. Taiwan established a national testing network. People who met the criteria within 14 days, as history of traveling, history of close contact with suspected or confirmed cases, history of cluster-related confirmed cases, are required to report to the CDC and placed for laboratory diagnosis. Starting April, patients with pneumonia are required to be reported and subjected to testing. The testing capacity in Taiwan has reached 18 testing institutes for 9,433 cases per day. A community surveillance network was constructed for accurate testing strategy. The plan focuses on the reinforcing screening for high-risk subjects. A map for 156 testing facilities designating for specimen collection was created. Moreover, 138 isolation hospitals have been designated for mild cases and 52 hospitals for treatment of severe cases. The number of confirmed cases in Taiwan has been reported since January 21st, when the first importing COVID-19 cases was identified. The gray shows the importing cases, and the orange shows the locally acquired cases. As of November 19th, Taiwan marked no locally transmitting COVID cases for 220 days. And the number of total confirmed cases stands at 607, and the COVID-19 death toll at 7. When a patient was confirmed positive, contact tracing was implemented by the outbreak investigation team of the Taiwan CDC and local health authorities. The period of investigation started at the date at symptom onset and ended at the date at COVID-19 confirmation. For a systematic confirmed cases, the period of investigation was based on the date at confirmation instead of the date at onset. All close contacts are quarantined for 14 days after their last exposure to the index case. During the quarantine period, any relevant symptoms trigger a COVID-19 test. CECC has introduced guidelines for high-risk individuals regarding self-health management, 14-day home quarantine, and 14-day home isolation. Self-health management for reporting cases who have tested negative and met criteria for being released from isolation, or people under COVID-19 community-based surveillance. 14-day home quarantine for those who with travel history, and 14-day home isolation for those had contact with confirmed cases. Starting from March 19th, home quarantine measures have been expanded to include arriving passengers from all countries. As of September 4th, around 215,000 people have been quarantined. People under quarantine have to complete isolation notice and self-health management notice, and will be contacted twice a day by local health agencies to follow their health status and providing assistance and care. Taiwan applied technology to help home isolation and home quarantine. Through the digital fencing tracking system, in cooperation with telecommunication operators, the location of people subject to home isolation and home quarantine can be monitored and a cell phone tracked. Individuals found breaching home quarantine orders could be fined. To prevent the spread of COVID-19 on campus, on February 19th, the CECC reminded schools to conduct cleaning and disinfection procedures on their campus and for school shuttles before the start of school semester. Suspension standard was that if one teacher or student in the class is listed as confirmed case, the class is suspended for 14 days. Once the school has 2 confirmed cases and the whole school is closed for 15 days. Universities also enforce access control on campus and activated COVID task force to determine the policy on recent course instruction. Students need to complete the health assessment form. And Taiwan domestic mask production capacity has now increased to 35 million pieces per day. That allows Taiwan to donate masks to the US, Europe, and other countries. From April 9th, Taiwanese can send masks to overseas relatives. And for the international collaboration, Taiwan held meetings with many countries to discuss over the disease prevention and control measures, as well as future collaborations. So here I conclude the key elements of Taiwan's success for keeping COVID-19 at bay: coordination between government, medical workers, and all professionals from different fields, and the whole Taiwanese society. Stimulus vouchers were available for pre-order from July 1st, and domestic travel subsidy program was initiated, such as culture tickets, art fund tickets, to encourage outdoor or arts and cultural activities in Taiwan, highlighting government efforts to boost economic activity and spur consumption. Taiwan has entered the post-COVID new life. The comment center continues to remind the public to wear a mask when entering crowded or confined places. The health education materials and videos are available in the CDC website for people to check the updated anti-pandemic information. Through implementation of measures, transparent information, and advanced technology, so that the people in Taiwan can maintain normal life and daily activities with only a few cases. So I would like to thank Taiwan CDC and CECC and all frontline anti-epidemic heroes, and Dr. Jianren Chen, Dr. Yueh-Ying Han, Dr. Hui-Wen Chen, and Nathan for all the support. So thank you for all your attention.
Thank you very much, Dr. Su. That was very clear, and I know we've already got some questions in the Q&A, so that's excellent. Hand over to you, Dr. Han. Thank you.
Good morning, everyone. It's my honor to be here to continue Dr. Su's excellent talk. Here, I'm going to talk more in depth of quarantine system for entry, also discuss some cultural factors for the success story of Taiwan, and a little bit leadership. As Dr. Su just mentioned, as of yesterday, we have 675 confirmed cases. You can see that due to the second and third wave of worldwide epidemic, our cases, imported cases have increased about 70 just past week or two in Taiwan. However, the death has remained at 7. So all this success is not without a lot of effort from government and from all the people. And I'm going to look into more closely about the timing border control. As Dr. Su has mentioned, that we were able to immediately prevent the spread from China from December 31st. And then we effectively monitor the international outbreak, and we adjust the travel notice and regulation promptly. And lastly, we implement the quarantine system for entry late in March. If you have been to Taiwan, you will see a CDC quarantine station in the international airport. And after 2006, Taiwanese CDC actually implemented the infrared thermometer non-contact tracing in the airport. It has helped Taiwan to monitor not just SARS, COVID, and also help to monitor other infectious disease such as dengue, Zika, and flu H1N1 in 2009. So just to show another timeline of our border control, you see that we start to implement it from January. By March 19th, foreign nationals were prohibited to enter Taiwan without special permission. By March 21st, all the countries entered Taiwan were defined as level 3, which were warning that all the passengers would need to go through our quarantine. And by March 24th, we decided that there's no airline passenger would transit through Taiwan for us to better control the border. This is to update Dr. Su's slide. As you can see that because of lower cases during summer season, Taiwanese government also loosened the regulation to allow short-term business travelers to conduct certain necessary business activity in Taiwan. So this is to show you that the regulations and policy has been constantly changing due to the worldwide situation. And also Taiwanese government is trying to as flexible and as humanly possible to allow people going through quarantine were able to attend special events such as funeral or visit ill relatives. Again, from March 19th, or foreign national not allowed to enter Taiwan without special permission, and will have to undergo a 14-day home quarantine. And be aware that you are not allowed to leave Taiwan or go abroad or go outside during the quarantine. And again, because the decreased cases worldwide, our CECC relaxed the entry measurement for foreign nationals that foreign nationals can enter Taiwan with special permission, but tourism or social visits still not allowed. This is to more specifically show you the requirement and regulation for citizen or non-citizen entering Taiwan. As of late June, foreign nationals were allowed to enter Taiwan, but you will have to show the certificate of negative COVID test before boarding. And because of that, we will better control the incoming passengers. And in response to the increased cases in the past month or so, CECC implemented the fall-winter COVID prevention program. From December 1st, disregard your nationality. You will have to show negative COVID PCR test when you go through the immigration declaration. But also, if you have, there's few circumstances were allowed to enter Taiwan. One was emergency situation. Second, if where you arrive from, the self-pay COVID-19 tests were not available, or you have a special program that approved by the CECC. This is to further to show you the detail of the quarantine system for entry that CECC has had. All this regulation has a legal basis called the Communicable Disease Control Act, and to be able to enforce all the regulation. So when you purchase the ticket, the airline would request you to go online to enter these forms. And then before entering the form, you will have to read through all these regulations to make sure you understand how serious Taiwanese government seeing this 14-day quarantine. And I'm going just to show you a few key points. First, you will have to have a cell phone available, and you have to be turned on of all time for 14 days. And you have to use Taiwanese telecom company's number. The SIM card can be available at the airport while arriving. And next, you have to enter the system again before 48 hours of boarding to make sure all the data is entered correct. And also, if you don't have a designated place to going through quarantine, they will help you to find the quarantine hotel through the website. So first, you have to fill out the health declaration form. For the form, you have to enter where you come from, your travel history in the past 14 days, whether you have a negative COVID test certificate we issued 3 days before boarding. From December 1st, even Taiwanese citizens will have to show the certificate. And then you have to identify the purpose of visit Taiwan. Next, they're going to show you the home quarantine notice to double enforce that you have to follow the rule based on the law. And just highlight a few rules that you would have to do is that you have to wear a mask of all time upon arrival. You have to stay at home or hotel. You can't go outside or go abroad. Even if you quarantine at home with your family, you have to keep social distance. And you have to record your body temperature and health status. Make sure your signal was available. And if you were to quarantine at home, you would not be able to stay with elder who are older than 65 years age, or those younger than 6, or whoever has a precondition. If any of these cases were in your house, you have to quarantine at the hotel. And most importantly, if you have any symptoms of COVID or fever, anything, you can't take the public transportation. You have to contact the local officials. They will have a designated vehicle or ambulance to escort you to the hospital for help. And here on the red box, they also tell you that all this can be enforced by the Communicable Disease Control Act and can be fined. Also, your personal data will be protected. Then you have to continue to fill out more information, including passenger information. Here you can see the seat number, which is very important because it has helped Taiwanese government to contact passengers who were closely seated with the positive cases. So it's rather significant effort. And you have to identify whether you have COVID symptom or ever taken medication related to the COVID symptom in the past 14 days. If you have any contact with suspected or confirmed cases during the past 14 days, and your contact information when you arrive in Taiwan, including your phone number, who is your provider, and your quarantine address. And last is the method for transportation. You were not allowed to take public transportation to your home hotel. Quarantine taxi, which disinfected between passengers, is available at the airport. And government help the hotel who participate in the quarantine program. They provide $30 to $40 discount per night. The rate is rather good, so to relieve the financial burden for passengers. So this is a simplified version of what you have to do if you decide to come to Taiwan for quarantine before going through travel. And this is the kind of simple version. First, you have to check in the quarantine system for entry before boarding. And on board, flight attendant will help you to if you have any question about the quarantine. And when you landed, you have to turn on the cell phone and make sure that you receive the home quarantine notice from CECC. Then you will go through the fever screening and system check desk. Then you can take this taxi, or you can rent a car to go to your home or hotel to undergo the 14 days quarantine. So there are a lot of services can be available during the quarantine. First, the local government official hotline, they would not only contact you once or twice a day to check your health status or your needs, and then also it's toll free that you can call them if you have any questions. A lot of hotels provide the meal package that you won't have to worry about the meals, or you can do the meal delivery services. And other services that you usually would have in the hotel will be all available. Your family will be able to visit, but they are not allowed to go into the room. They can deliver things that you might need or food that you might want. And the last, if you have any suspected symptom or you don't feel well, they will have designated ambulance or vehicle to send you to medical care when you need it. Keep it in mind, you still have to do another 7 days self-health management after quarantine. And different from the home quarantine, you are allowed to go outside, but you have to wear a mask of all time, and you still have to record your body temperature and health condition. There's also a guideline for a confirmed case to enter Taiwan based on the Control Act. If you had symptom or had COVID more than 2 months before landing, you're allowed to enter. And if you have symptom in the last 10 days, if you can produce 2 negative COVID tests, you are allowed to enter. And if you have the symptom or develop the symptom when you fly, a COVID test will be taken immediately, and it will be sent to a designated quarantine center. If you have 2 negative results in 2 days, 20 hours in between, you were allowed to go back to where you were supposed to be going through quarantine. And if you test positive, you will be sent to hospital immediately, and with doctor and nurses to follow up. So all these system or have some financial kind of incentive. It would be if you are Taiwanese citizen or alien resident, you will be qualified to obtain about $30 per day allowance. And if you are the family member, you need to take time off, they cannot go to work, you will be qualified as well. If you live alone, and government will provide necessary help for your 14 days quarantine. Also, for those foreigners who are trapped in Taiwan before the pandemic, they have been automatically extend your visa for you to stay. As of today, I think the extension has been issued for 7 or 8 times because it has been a long haul. There are a lot of good and bad experience for people share the 14 days home quarantine online. Some people feel like they were treated as prisoner, and that's understandable. But most of the feedback are really positive. They're a Belgian couple. They actually recorded 14 days quarantine experience on YouTube to share how they went through it. And most of people think it's better than expected. And there's a American citizen, he even recorded a video clip to thank the police liaison who check on him every day, make him feel not alone. And he also feel like it's the safest place in the world when he was in Taiwan. Another Asian American author, he flew back Taiwan. She think that the most difficulty is to try to get some exercise when you're in a small space for quarantine. But as time goes by, it gets easier. And she also thinks that you have a lot of time to have self-reflection and think of that what I'm doing is good for the public. Next, I'm going to talk a little about cultural factor. There are a lot of challenges, but I think we do have to talk about it to discuss a little bit how it helped Taiwan to be success in control COVID. First is the face mask wearing. As you can see here that we implement face mask wearing rather early, and everyone did it, from our president to CCC press conference. The message is try to be as clear as possible to encourage public to wear the mask. And as compared to Western countries, the wear mask is more stigmatized, and a lot of people fight for it and question the needs to wear them. So they kind of lost the kind of prime time to prevent the COVID spread. And also in Eastern country, or at least in Taiwan, a lot of people would wear masks even before the pandemic, mostly to prevent exposure to air pollution, traffic exhaust. Even during the flu season or allergy season, people would try to wear it to prevent exposure. And when people feel sick or ill, they'll wear masks to go to public, also work or school. And some people wear it for winter to stay warm. So because of all these factors, to implement face mask wearing is much easier and quicker as compared to Western country. And there's an American who stayed in Taiwan during the pandemic. He said it's like a mask island, that wherever you go, you can see people wear masks. For public transportation, open market, school, and taxi driver and public drivers, they all were prepared to try to prevent the spread. So the success is not without challenge and flaw, but the government in Taiwan try to be as transparent as possible, as open as possible. And a lot of people, even in the early time, there's some misinformation, there's some discommunication, and cause some panic buying, or like not knowing how to wear masks appropriately. But due to through the open communication, understand what mistake has been made, they were able to do the bilateral communication through everyday CCC conference. For that, I think indeed to limit the space for distrust and the rumors. So I believe the early implementation of being transparent, open is really helpful. And also, a lot of people are concerned about privacy through the tracking or the electric fence system. The government has showed that we do have a special act to access this data, and it's set to expire on June 20th next year. And it all depends on when pandemic will be end, but they try to guarantee this personal data will be only available to CECC. Even the police force try to help to locate the quarantine individual. They will only be access to the name, the phone, and the address. They wouldn't be able to access to any other personal information. So they also guarantee that all these data would be destroyed and deleted when the special act expires. However, there's still question about how secure they are before they were deleted. This is the question that we can be asking the government or try to have them more transparent. And also the economic incentive is also helping. They provide a subsidy for people who have to go to quarantine. Also, as Dr. Su showed before, that they also have triple stimulus to help the industry to go over this hardship as well. And also we have a platform called Taiwan. It's a voluntary participation that anyone can go on the website. If they have any opinion or complaint, they can go online to file them. And government usually try to respond as much as possible. And of course, they'll come down to public in-person changes. It is not easy to go in through all this behavioral change to limit their activity to prevent the COVID spread. I'm going to talk a little about more since I'm in the States. I feel a little bit more on the difference between my Taiwan culture and people in the States.
Probably just 2 minutes left, if that's okay, so we have time for questions. Thanks.
In I would say Eastern culture is more collectivism, which means that they feel more connected to others. Your behavior would affect others as well. So implement mask wearing, think of that's a public good. It's much easier than Western country that they would question what I have to do and authority before they implement it. So I do think they have waste a little bit of time of prevent the COVID spread. And as compared to Taiwan, it's an island, it's much easier to control the border. As compared to United States, they say 50 state as like 50 economy entity that every state have their own policy rule. Without a centralized command center, it's rather difficult to control the virus as a whole. And I'm going to talk a little about the political division that, as you see the research here, there's two very different views of Republican and Democrats. And because of that, it's also very difficult to control the COVID spread as a whole. Also, the lesson we learned from SARS is more than learning experience and cultural factor, that we got affected much more than Western countries, and we learned the lesson hard. So after that, we did implement a lot of changes, including public health policy and epidemic prevention. They included this, but not limited to regulatory review, organizational adjustment. I think it's important because when the organization has been connected and collaborated, then when we activated when epidemic happened, it can save a lot of time. Also, we have practical operation include increase the isolation room and ventilators. We also have outbreak drills in the hospital regularly that make the surveillance and control much easier. Last but not least, I'm going to talk a little about our leadership. Our Vice President Chen Jianren, he is epidemiologist. So as New York Times says, Taiwan's weapon against coronavirus is him. He said being scientist is helping him do problem solving, be innovative. And he also said that the decision making is based on evidence, not personal political view. I think that's really important. Last but not least, our President Tsai Ing-wen She has been an interview on a lot of major magazine and news. If you have not heard about her, she's decisive, she has compassion and patience, and she's warm but authoritative that not only can have the power to talk to the other aisle, but also talk to the people. So I'm going to finish our talk by her quote. She said, "The human capacity to overcome challenges together is limitless." So hopefully by working together, sharing experience together, and I do believe the pandemic, end of pandemic is in sight. Thank you.
Thank you very much, Dr. Han. That was, I think everybody listening will agree, that was really, really impressive. And you kind of wonder how the UK ended up where it is based on the amazing progress you've made. So we have a huge amount to learn. So Dr. Su, if I could just ask you to pop your video back on as well, that's great. We've got loads of questions. I'm just going to start with the most popular one, which is from Anthony Tutor at the top of the Q&A. He asked, so maybe if I ask you first, Dr. Su, whether there have been any objections from the public to any of the measures, any concerns, any dissent? Thank you.
Well, I would say there was, of course, some doubt or questions about the government measures. But as I said, the CECC, the Central Epidemic Command Center, hosts a daily press conference every day, live stream, and followed by the Q&A section, just like here. So anyone, if you have like public question or any objections can ask. And then because of the CECC is composed of many experts from different fields, so the professionals and the experts can answer your question and then explain why the policies are. And yeah, I think that is make more clear for the questionable objections.
Thank you, that's really, really helpful. And those press conferences continue, do they even now? They're still going on, yeah? Yeah.
Yes.
Yeah, great.
Not every day, but once a week, not at all, because the conference cases right now is stable, so.
Very, very, I think it's such an important communication route. So question for both of you, maybe I'll ask Dr. Han first. A question from Lawrence Brewer. Despite the great success of Taiwan's strategy, in the light of experience, are there any aspects that you think could have been improved, maybe from a scientific or a policy perspective? So to you, Dr. Han, first.
I think I was checking the news regularly. Earlier pandemic, it was indeed impressive. A lot of people think that the CECC did a very good job, and I don't have a lot of opinion about the disadvantage, but the panel was composed by all different medical scientific experts. I think that's very impressive because you don't see our president at the press conference. She gave it to the scientists and medical expert, and I think that's very impressive because the audience and the people need to hear from what they're good at, which are the medical experts and the scientists. So for that, I think very important as compared to some other countries. So for that, I think it's make the public easier to accept the guidance and then the information because we don't have much more room for error. So I think that's the thing that most people can learn from.
Dr. Su, anything from you that you think could have been improved?
For me, I think if really anything I say need to improve is that I think before the intense period of the pandemic period of time, people were aware of the pandemic situation. But after the very tough situation, like right now, people in Taiwan a little bit like relaxed and they go to like because the government also encourage the travel and to boost the economy, and then but I also worry about like the crowded galleries. So if I say anything to improve, I will say maybe people in Taiwan should still notice about the regulation, like wear mask in the crowded places.
No, that's really helpful. And I think Richard Simpson had a question about communication, but I think we've answered that as well. So I'm going to try and put two questions together. What has been the effect on the Taiwanese economy? I know you're not economists, this is not your area of expertise, but if there's anything you can say about that. Let me just see if there's anything else. Yeah, so I guess I'll just ask the next question. So two questions together, any effects on the economy? And secondly, I think you touched on this, Dr. Han, but what are the checks that are done on the people quarantining? I think you said the police check in every day, but if there's anything else you can say about that. So maybe if we start.
I can answer the second. Okay, I can answer the second question first. The main difference of self-isolation and self-quarantine is not big, but one thing, when you do the self-isolation, since you have contact suspected or confirmed cases, there will be health official to check on you. For home quarantine, mostly would be local civil servants that they will check on you. And often you won't have police to check on you unless you were disappeared, the signal is disappear or you cannot be reached. That's when they will, after I don't know how many times of attempt, then they will ask for police help. But usually they would have had health official or local civil servant to help, not police until to the end necessarily to check on you.
Any comments on the economy, Dr. Su? How's that going?
Yes, I think a few of the cases were police checking because most of people just stay at home when under quarantine, and you just answer the phone when they called to show that you are not outside. Otherwise, you could be fined strictly. So I think there's not much the cases. There's just few cases that disappear. So the police come to you.
Great, okay. And just on the economy, I don't know who asked that, but my reading, if you look at the GDP decline in Taiwan, it's far less than a lot of other countries. So their economy has benefited from their approach. So the big question here, I think, is, and I would ask both of you this, and maybe start with Dr. Su. What are the main things that Taiwan can teach the international community for future infections? Given and taking in mind that, we might have another epidemic or another pandemic. So I guess what are the key lessons from Taiwan in summary?
Yes, as I show in the first few slides, firstly to aware of the pandemic and then respond quickly. And because listen to the scientific point of view, and then that the transmission could be like human to human and could be transmission by you talking and face-to-face meetings. So you should immediately wear mask, not only prevent yourself, but also prevent others. So I think how to prevent is like the slide, the 8 success factors I showed. Listen and follow the scientific suggestions, and then the transmission route, and then do what is necessary. Yeah.
I think that summarizes it. Yeah, those 8 points in Dr. Su's slides. So colleagues, do have a look at that. Anything you want to add, Dr. Han?
Yeah, I think what Taiwan learned from SARS would be what people learn from COVID. I list a couple points, not all of them, but I think one of the important thing is the regulatory amendment. You can say because of the strict rule or laws that you can be fined and then you have to follow. I don't think it's the best approach, but when it comes to necessary, I think it does help that we have a legal basis to recommend or encourage people to follow, and you got to warning, then you get fined. And I think again, not the best approach, but have a legal basis does help. And the organizational adjustment in Taiwan, all the different institute organization work together. They link together. They don't fight each other. They don't provide different information. I think for me, being seen what happened here is very confusing. You have a local government, you have CDC, you have the White House task force. You don't know who you listen to. So I think this is really important to have a centralized command center to deliver clear information. And last, the operational practice. This is very important because we learn from SARS. We don't have enough isolation room. We didn't have enough ventilator. We prepare for it. We prepare for it from 2003. Now, 17 years later, we got to use them. And you can say, oh, we never used it for 10 years. Should we cancel it? I know some people think so, but we also do the drills that literally you have to practice. What if today we have epidemic? Then what as a hospital have to do, outpatient, inpatient, ER. So I think this is very critical view that everyone can learn from.
Excellent. That's really some important takeaway points. I'm going to hand over now to Professor Rudan, who's going to chair the last 5 minutes. Igor, are you there?
I am here indeed. Thank you.
Thank you very much. I'll hand over to you. Thank you again to Dr. Han and Dr. Su.
Thank you, Linda.
Thank you.
Dr. Han and Dr. Su, it's been such a privilege for us in Scotland and in the UK to be able to learn from Taiwan, which really, I mean, has been a fascinating example of how if you mobilize the whole of society and then just prepare very well for the pandemic, that you can get good results, you can save lives and save the economy. So it's not either or. Thank you so much for sharing this, for such a comprehensive presentation. I'd also like to thank Professor Linda Bold for this wonderful webinar series, and also Professor Aziz Sheikh, who is a director of the Usher Institute, for envisaging this webinar series. I'd also like our Usher communication team, so reliable, Susan Buckingham, Jess Conway, helping us to connect with all parts of the world in this webinar and deliver to the world this exciting series. And also, I would like now to announce the next webinar. Maybe I should say that this exciting collaboration between the two of you and us has started through the Journal of Global Health, which we started here 10 years ago, and we never knew where this would lead. Today it led us to be able to ask for your help and advice. In the similar way, we also contacted two more experts who we worked with in the Journal of Global Health, Dr. Naeem Shahzad from Pakistan, and Dr. Raj Kishore Biswas, who is from Bangladesh but based in Australia. So please do join us on the 16th of December from 9 to 10 o'clock. Their title will be Addressing COVID, Pakistan and Bangladesh, Public Health Interventions, Policy Response, and New Research Findings. So please do register. Registration is not yet open, but you will get invitation. Please do register and invitations will be sent. So thank you everyone who joined this, and particularly again Dr. Su and Dr. Han for this wonderful presentation you shared with us. We are really, really grateful. Thanks very much.
Thank you.
Thank you.